Thank you, Mr. Chairman. Secretary McDonough, it's good to see you, and I think this is a great opportunity to sit down and to talk about what's going on in the VA and to learn
Yeah.
from you, from your perspective, what's happening. I'd like to talk about specifically the implementation of the Mission Act
Yes.
and about kind of what's going on with regard to referrals outside of the VA
Yes.
facilities themselves.
Yes.
I think the clarification that you could provide on the referral coordination initiative, particularly how this initiative affects veterans' access to the community care. I think that's the area that I really want to focus on. You may have seen the results of the investigation conducted by USA Today that was released earlier this month. This report points out examples of VA actively denying access to community care.
Yeah.
I presume you're familiar with the article.
I am, and we dug very deeply into each of the instances, and obviously can't talk about a lot of that. In fact, I'm not even privy to myself to each of those cases, but our team was up here yesterday talking about this. We dig into each of those cases to make sure that we understand what happened.
Well, I think we've got a real problem, and I think it goes back down to dollars and cents. I have concerns that these examples are not isolated, and that they could be the result of the implementation of the RCI in a way that diminishes veterans' choice.
Yeah, I just don't agree with it. So.
Well, let me share with you the reason why my concern.
Yeah.
When a VA primary care provider refers a veteran to community care because they believe it's in the veteran's best medical interest, does the referral coordination team have the power to override that decision?
No, and in fact, it's not even the primary care provider's decision. It's the veteran's decision. And so our job is to make sure that the veteran is aware of his options and that we move with dispatch to execute his options, and that it is, in fact, best medical interest that determines that question.
I think this may be where the problem is, because I think if the veteran actually makes the decision himself, that's one of the reasons why I challenged the Mission Act in the first place, was I didn't read the law that way. And I'm not sure that a lot of the folks that are implementing it read it that way either. And I'll just give you an example. The department's guidebook on the referral coordination initiative features a call script, a framework that members of the referral coordination team can use when speaking to a veteran who is eligible for community care. The call script framework recommends RCT members remind these veterans, and I quote, "You should know by choosing the VA, we can better coordinate your overall care because we have the results of any services or tests in your health record." It just seems to me that I'm not sure it's appropriate for the RCT members to be suggesting that the VA might be a better option for a veteran, even after a veteran's primary care physician has determined community care is in the best medical interest. And I don't think that's the way it was sold to a lot of folks here. And I'm not sure that's the way that you would see it either.
Yeah, I don't. In effect, well, let me put it this way. GAO released a study last month wherein they found that care in the community is more difficult to coordinate. It's more difficult to get lab results. It's more difficult to get test results, and therefore more difficult at the end of the day to coordinate that care for that veteran. That's not my finding. That's not the Referral Coordination Initiative's finding. That's the GAO's finding.
But either
at the end of the day, then.
But either it's the veteran's choice or somebody else is making the final decision. And see, I really do think it should be the veteran's choice.
It is the veteran's choice. That's what the law says.
And yet, I think a lot of veterans feel that that's not the way it is. And in fact, within this article, there's one item that really was, I think, pointing to the fact and the concern that I think Senator Blackburn had tried to address a little bit.
Yeah.
And what I really feel strongly about. The part of the article says Dr. Kathleen Kim, who is the San Diego VA Chief of Staff, said physicians sometimes incorrectly try to relocate patients for treatments her hospital can offer, which would be internal, And administrators are regularly educating them to help keep veterans at the VA. And then the direct quote, because of the nature of the Mission Act, the VA is sending a lot of care in the community. And frankly, we're worried that we're not going to be able to pay the bills, end of quote. See, Mr. Secretary, I really think there's more of a driver here with regards to dollars and cents than what there is to making sure that the primary responsibility is to get that veteran the care that they want. And I'd really like to explore this a bit more. My time has expired, but I think we've got a serious problem here that's not going to go away.
Yeah, well, look, I mean, I'm just looking at the month-by-month obligations for care in the community. So
Going up?
September, $2,067,412,193. So we had basically 4 months above $2 billion a month. That's significant investment in the community. At the same time, this is by definition outpatient care, correct? Satisfaction ratings for outpatient care, north of 90%. That doesn't mean we're at 100. And I didn't deal a lot in the 90 percentile myself, but 90 percentile is good. I'm like a 70 percentile guy. But that's not to say that there aren't problems. There are. It's a big system. And when I find a problem, I snuff it out. But to suggest that by design we're breaking the law is an overstatement. That's what the article suggests. We took it very seriously, including with the team in San Diego, to get to the bottom of it, as you, I think, would expect us to do. What I believe is that we are giving best available care to our veterans, including historically high levels of care in the community. I think that ultimately reflects the veteran's interest. I want us to compete for access to that veteran.
And I like the idea of competing, but I want it to be on a field that says we can provide equal or better care, and the veteran makes the decision.
And we do, and that's what the GAO concluded.
And I appreciate your thoughts on it, and I'd like to pursue it further.
I look forward to that very much.
Thank you. Thank you.
Great.
Thank you,
Thank you,
Senator
Mr.
Rao.
Chairman.